Hi, welcome to Facebook Live. We're back. Sorry about the break last week. And we're here to go over the most local information we have and to answer your questions. I'm Dr. Annette Mercatante. Sorry, I forgot to introduce myself. All right, let's go to the data. So you see our cumulative data, which continues to include all COVID information from the onset of the pandemic in March of 2020. Oh my gosh, how quickly we go by. So again, this is cumulative data, cumulative hospitalizations and deaths. And then the changes in the last 7 days, you can see that we've had in the past week over 2,000 new cases with about 300 daily new cases that we have in our system. Um, we've had 29 more reported deaths. And again, I'll say that all of these deaths did not occur in the last 7 days, but what has been reported to us in the last 7 days. And our testing positivity is 37.1%. I thought it was down to 35%. It's hovering around 35 to 37%. Next slide, please. And then this is our epi curve, and you can see that we are higher than we've been before. Really, we have a higher case count, higher everything than what we've had previously in the pandemic. Some early signs that this could be reaching a peak, one of our plateaus that we so eagerly await for. Many predictions. Well, we'll talk about that next. Next slide, please. So this slide. So this is one of the modeling slides that we received from the state of Michigan. These use complex computer modeling systems, and they anticipate where COVID is going based on a number of factors, and they use an optimistic and most pessimistic slide. So that large blue peak is our most pessimistic. If you look closely, and you can't really tell from the slide, but if you look closely, that peak is now essentially with this modeling. And that's again why when we look at our own data and it seems like it's leveling off, we feel optimistic. If you'll also notice that for all the modeling of Omicron transmission, there is a precipitous increase and a precipitous decrease. In other words, it comes up quickly, and with any luck, and as the data is suggesting throughout the nation and the world, it falls quickly as well. How far it'll fall is not always clear. Will it fall down below baseline, or will it come down to a kind of, we'll keep talking about endemic levels? I think that remains to be seen, but clearly we anticipate a rapid decline of cases, and we're hoping that that's true. Next, and the other two slides, by the way, are hospitalizations and deaths, which we've talked before, lag a couple weeks behind the case counts. This is some of our preliminary data. We talked about how this week, as you know, with the mask order, this week was when our team doing a lot of huddling and a lot of digging to review as much of the information we have from the last 3 weeks, 18 to 20 days of the month. And this is what some of the information we have. And it's very encouraging that the mask order has been effective. And part of this slide, I'll just premise this by saying that what we looked at was the number of cases, the increase in cases, the proportionality of cases last fall between summer break and when the kids went back to school in September, right? And we saw at that time an increase of a certain percentage amount, as well as how many kids in the population, school age children, how much of them represented out of the total cases. So we use that as a benchmark. And of course, it's not a perfect benchmark because we have a different variant now. which, if anything, we would expect an even higher rate. So, our expectation, our prediction of the number of cases in school age children with no mitigation factors like a mask was that we would be seeing about 85 school age cases per day in January. And in reality, what we're seeing is about 35. So, good news, encouraging news, not proof of anything, but as an indication that certainly the huge surge that we were anticipating. And by the way, again, once more, that 85 cases per day is based on the transmission we saw with the Delta variant. And I can't emphasize that enough. As our team looked at the impending Omicron surge, we anticipated these numbers to exceed what we saw in September. So that's all good. The other thing I just want to remind everybody is that one of our primary goals was to keep kids in school and keep our schools open, as we anticipated a lot of schools getting hit very quickly, very hard, and having to pause and go to virtual learning because of the sheer number of cases. And so far, knock on wood, our schools, all of our schools in the district, have stayed open for in-person learning right from the first day of return to school classrooms. So, a couple of promising, encouraging pieces of information. Next slide. This is our vaccination data. Vaccinations remain the single most important way we can build resiliency in our community against COVID and against further COVID strains. We're behind the eight ball with vaccinations, but I just want to say every week we vaccinate a few hundred more people and about 1,000 more boosters are given. So we are making some progress. It's painstakingly slow. And you can see that we, in our 5 to 11-year-old group, we're about half of what the state is reporting for that same age group. Again, this transmission in the school age group will be markedly reduced with more immunity, vaccine or natural immunity, I might add, at least for the short term. Vaccines, we believe, give a more robust protection against reinfection. Next slide. This is the one I was referring to. So you can see the encouraging news is every week we're giving a few hundred more primary doses. That's the dark blue, or I guess the bright blue part of the bar on the bottom are the first initial doses. The lighter blue at the top are the booster doses. And you can see that we are continuing to give a good amount of booster doses as well. Not as good as we should. So here's our data dashboard. We constantly update our data dashboard. Again, the emphasis for everyone should be on trending and what we're looking at. Some of this data is very reliable, like deaths, okay? Those come in having been vetted through vital statistics. Cases are invariably undercounted, but again, a good idea of where we're going and which direction. And then I also want to attract people's attention to our FAQ section, which does respond to the commonly asked questions, which are kind of always the same. And we try our hardest to make those responses clear and easy to understand. And we update those regularly. So let's get to our questions. And before that, Jen, you want me to read through our talking points, right?
Yeah, today's talking point will be about at-home COVID-19 testing, since that was a big news in last week.
So as you know, the federal government opened a link where you can order for every household 4 tests. COVID testing is, I think, a very important link to a more normal life and moving beyond the pandemic. And that's because you can easily assess how infectious you are. Not 100% guarantee, but certainly better than just guessing whether your cold or sniffle is COVID or whether it is allergies, right? So constant back and forth. We do have rapid tests now, again, available at the health department. And when last week, was it last week we paused because we didn't get our shipment in? I believe we are actively seeing testing again to the same level we were before. But I do want to remind people when to use an at-home test, right? or even a rapid test with us. You want to definitely test if you're experiencing symptoms. And again, these are respiratory symptoms, but they're vague and nonspecific. So anything from sniffles, sore throat, headache, certainly a cough, any of those symptoms would prompt you to do a COVID test. If you're exposed to someone who has been diagnosed with COVID-19, you want to test, ideal about day 5. There is a substantial number of people who get infected and have such mild symptoms or no symptoms, they may not know it. And knowing you have COVID allows you to protect other people around you by quarantine, by masking, by not going around vulnerable people within 6 feet. So that testing process about day 5, it doesn't help really if you test the day after your exposure. It takes a few days, at least probably 2 or 3, more likely 3 to 5, for your body to replicate enough virus where it can be detected with the viral antigen swabs. Okay, so antigen tests do work. They are more likely to be falsely negative if you don't have enough viral load in your nose. It may not detect it, but if you have enough virus that you're shedding a ton of virus, it's going to find it. So if it's a positive test, you're positive. Just assume that. If it's a negative test and you really are suspicious, my suggestion is either come and get a confirmatory test, which would be a molecular PCR test. Sometimes there's a delay with that. So you wait until you get those confirmatory tests back before you go back into society, or you wait and you do another rapid test in a couple of days. And that often can be, that can tell you what you need to tell. All right, another couple reasons you'd want to test. You want to test before you travel, and you want to test before you go into large indoor high risk settings. We talked about that around holidays. You're going to visit grandma, you got a bunch of people coming into a household for a dinner party or whatever. It's really a great idea for people to test before they all gather like that. It's just a nice thing to do, right? It's courteous for all those around you. So those are the reasons you test. And I think as more and more tests become available, this is going to be common information. No test is 100% accurate. So having a convergence of tests, one negative, one positive, that happens, and then you need to consult your doctor, or you got to give us a call, and we'll walk through it and kind of decide what would be the best the best compromise with divergent testing. All right.
The other thing I'll just add to Doc about testing is that there's multiple places around the county that do testing besides the health department. There's most of the pharmacies, urgent cares, possibly your own primary care doctor, the hospitals.
And we have
So
a test finder site still in our link or on our
yes,
website,
yep.
right?
On our
Okay.
COVID page, we have a testing section with all that information. Okay, a couple questions came in prior to today, so we're going to go over those first before we get to the live. The first question is, due to the temporary suspension of walk-in rapid testing, can we expect a slight reduction in the number of reported COVID cases in the county? Naturally, the number of infections will continue, but I wanted to know if the number of reported cases might artificially dip because of fewer tests. This is when we
No, not
suspended that.
likely. The temporary suspension of those walk-ins probably had little or no effect with our overall test counts, because it really only represents a very small amount of test results that we get into our system. So we get test results from laboratories from all over the place. So no, it's not likely to have created any false and by the way, we are still seeing, and even with rapid testings in the home that are not being reported. And the other thing people say is, oh, well, if we're not getting all these reports from rapid antigen tests in the home, how do we know that we're following the trends of this virus effectively? And that's because we're still seeing a very robust amount of PCR testing that's coming in through the labs into our system. So that number of tests still gives us the information we need. Let's go back to the idea again. Don't stay focused on whether it's 329 or 389. What we want to look at is where we are relative to the previous week, the following week, and previous times in this pandemic.
Okay, the next question was, do you plan to extend the current public health order on mask mandates for educational buildings? If so, what will need to occur to end the public health order?
Well, the public health order was written to expire automatically at the end of next week, which would be January 28th. So it's written that way. So in order to extend it, there would have to be a formal uh, uh, out we would have to redo an order, a formal reissue, a new order. Okay. With that said, we are still looking at the information closely. None of us favor putting orders in place. We know that it's divisive and contentious and causes a lot of conflict. So we're looking at that data very closely, as we said we would, and we'll be deciding definitively after we speak to all of the players, the community players, the schools, our boards, and all the people involved. So more to come.
Okay,
Oh,
third
you wanted
question.
to? Oh,
Oh,
wait,
go ahead.
wait. They wanted to
Go ahead.
know. What kind of things that we're considering, which is a good question. So I showed you a little bit earlier some of the data, and again, this is very limited data that we can look at the first 3 weeks. Obviously, it'd be nice to have a full month, but we have to make our decision before the month is over. So we'll be looking at that data compared again, expected versus actual. We'll also be looking at the whole Omicron surge itself, both locally and statewide. We're going to be looking at our community partners. How are our hospitals doing? How are the supplies doing with testing? We want obviously a good input from our schools and from our educators and how that's going for them. And then putting that all together, um, remembering that our goal of this was not to stop the spread of Omicron, but to blunt the impact it was having on our schools and our school age children, primarily trying to make sure that they stayed in school and continued in person learning as much as possible. So there you go.
Okay. The third question that came in last night was, will you be distributing the free N95 mask? If so, what do you expect to when do you expect to do so, and what would be the process? And then thank you for giving your best to this always changing and evolving moving target virus. It cannot be easy.
No, this isn't easy. This has not been an easy thing at all. But thank you. And we are doing our best. I want everyone to know. And it's just not me in a vacuum. We have a great team, and we consult regularly with other experts and state and national experts. So it has been challenging, but that's what we do. That's what we're here for, to protect the health of the public. So, anyways, we do have a limited supply of N95s. Let me preface that by the whole mask consideration of what the CDC has issued. They didn't say that cloth masks or surgical masks were ineffective and therefore just don't wear them. They said that there's a natural gradient of effectiveness for masks from the most effective to less effective. And finally, you need to choose a mask that you can tolerate for the longest possible time. The more effective a mask is, as you get into those N95 models, the more uncomfortable they are. Okay, the more they withhold the exhaled air, and the more uncomfortable you may be with them. So some people are not going to tolerate N95, and that's okay. Just put on a more comfortable mask. Try and make sure it's clean. Uh, Rotate it regularly and wash it appropriately. And any mask is better than no mask. So I just want to make that clear because we got a lot of emails that said, see, masks are worthless. And that's not what the CDC was saying. They're just saying that, especially with Omicron, with its high level of transmissibility, the more effective the mask, the more likely you're going to provide yourself a barrier against infection. And a lot of that is the timing involved. So it takes longer. The better the mask, the longer it would take for enough virus to penetrate in order to infect you. That whole idea of viral load is very important with COVID. So it with a looser fitting mask with things, or God forbid you've gone to a gaiter or a face mask, that's going to let a lot more virus in more quickly, and so you have less time. Remember, we use that 15-minute mark, that most people, if you have exposure under that 15 minutes, it's not likely to provide enough viral exposure to cause infection. It's not a guarantee, but that's the transmission rate. So the better your mask, the longer you can be in close proximity with other people. Okay, so if you're wearing a lesser mask, keep that in mind. How close you are to other people and how long you're next to them. Back to our masks. So we have a limited supply now, but we are expecting a large shipment in the next few weeks. I don't know exactly when we will get them. Once we receive those masks, we will be distributing them to community partners for distribution as well. So I do anticipate more masks being available for distribution in the coming weeks. Okay.
Okay. All right, we're going to move to the live questions now, Doc, and I just want to let you know it's 3:49.
In other
Okay.
words, don't talk so much. I'm hearing you. Okay.
Okay, first question from Yvonne. How long after a vaccinated person gets COVID can they get the booster?
So whether you get a primary vaccine, like you've never been vaccinated and you want to get vaccinated, or the booster, all you need to be is better from your COVID infection. And you have to be out of isolation, which is still that 10 days. I would still wait 10 days, although the CDC is saying you can leave your home after 5 days if you're fully masked. But you basically just need to be recovered from COVID to get your COVID vaccine. Now, remember, boosters have a time frame from when you were primarily vaccinated. There is 6 months, right? God, my brain. 6 months from the your primary booster series till your booster, unless it's J&J. The J&J is 2 months from your primary series to your booster. So there's two intervals there, but they're not related to you being sick. With illness, you just want to wait till you've recovered, you feel better.
All right. The next question is from Nikki. Actually, the next two questions. First question from Nikki. If we are at 37% positivity rate, then why are the schools not going virtual? Vaccinated and boosted are getting very sick.
Okay. So first of all, vaccinated and boosters are not getting nearly as sick. Very few people in the hospital who have been vaccinated. That is still holding true. Although a lot more people are getting sick after vaccination with Omicron. There's no question about that. It's escaping some of that, but it's still the vaccines are still working very, very well to keep people from getting into the hospital. All right. So I guess you can still be pretty sick and not go in the hospital. I understand that, but there is still, I want to make sure that people understand there's great value still in the vaccine. There's also some data that suggests that people who've been vaccinated have a much shorter duration of viral transmission and they shed a lot less virus, so they're less infectious and they're sick for less time. Preliminary data, but there is some of that now that's starting to come out. So 37, the school closures are not to attempt at the beginning. We shut everything down because we were trying to control the transmission of the virus in the community. That cat's out of the bag, right? I think it's very clear that trying to shut down schools and shutting down businesses, etc., does not stop transmission. It might delay things a little bit, but it does not stop the transmission of the virus in the community. Schools pause because there's so many people sick at one time that they can't function. They don't have the teachers. They drop below the required attendance level that they can count it as a school day. Okay, so please keep that in mind, that keeping kids from going virtual in school isn't about preventing the virus from spreading. It's about preventing everybody getting sick at the same time, which was the value, I believe, of why our mask order was so prudent when kids were first coming back from their winter breaks and all going back into the buildings at the same time.
Okay, Nikki's second question was why are the vaccines not working on Omicron?
The Omicron variant had multiple mutations on the protein spike, which is where all the vaccines work. Their target when we receive a vaccine, it creates it presents to our body's immune system that protein spike, and as a result of that, our bodies build its army. Our bodies build our natural defense mechanism against it. So when the real virus enters our body, it recognizes that protein spike and attacks it before the virus is able to replicate and make us sick. Okay, so when this virus mutated, there were multiple mutations on that protein spike, which changed it enough that the vaccine, the picture, the protein that the vaccine uh, uh, not illustrates, shows to our body is slightly different now than the natural virus itself. And as a result, it escapes or evades our natural immune system. It's doing the same thing from a previous, if you were previously infected with a different variant of COVID. Your body responded by creating immune response to those proteins from that previous variant, previous COVID type. And now when it's shown the Omicron virus, your body's immune system again is not really saying. It's why we're getting so many breakthrough infections, not just with vaccine, but also with previous natural infections. Tricky
All right.
viruses. Smart. Yeah.
Kathy mentioned earlier that we keep freezing. I don't notice it on my end, but if Luke, our IT person, is around, if he could just double check that.
He's no longer here.
Oh,
Sorry.
okay.
Unless
All
he's
right.
watching somewhere else. Sorry. I'm not
Um,
freezing here though either, so I'm not
okay,
saying it.
not sure.
Sorry
Cindy
about
asked,
that. Mhm.
why are children being made to wear masks? It states right on the box, masks don't protect against viruses. My granddaughter is wearing one to school and was out sick all week. They obviously don't stop viruses.
They don't stop viruses, they reduce viruses. They reduce the amount of virus that can get to your child's respiratory system over a short or prolonged period of time. So when things are put on the boxes, if you know, statements are always there. You know, don't eat this, don't swallow this. They're put there for consumer protection, and but we do know that masks help a great deal. All right. They are not the panacea. Vaccines work great as well. In fact, if anything, between masks and vaccines, I would say the vaccines are a much, much more impactful approach to reducing the spread. But we don't have enough people vaccinated either. So the children were ordered to wear masks because, as I mentioned earlier, we had a situation where we were watching the impending development of Omicron. All these kids had been on break and they were all coming back to school on the same day or certainly the same week. And there was anticipation. In fact, we were watching many schools closing very quickly because of the sudden rush of cases that were occurring in the schools. Children come back, they're in a congregate setting. We also know that we don't target children, we prioritize children. As any good community does, we want to prioritize the well being of our children, and children not being in school, we already know is a bad thing. Okay. And children taking infection home to their families is a bad thing. So we wanted to reduce that impact as much as possible. We didn't believe at any point we were going to stop it or make it not happen. Okay. So I just want to be very clear. There's still a value of reducing a negative impact by doing things that work, as opposed, it's like, just because it's not going to stop everything doesn't mean you shouldn't try to reduce the harm being caused. So I hope that helps that explanation a little bit.
Okay, the next question is from Nikki again. She said, should children get vaccinated after Omicron or are they immune?
So you shouldn't rely on natural infection solely as a way of avoiding future infections. Right now, we only have the vaccines that were developed before Omicron, but we do know that if you get vaccinated, even after a natural infection, you are even more protected than you are with just a natural infection. And I would just want to put a call out there that please don't think that the best thing to do is just wait to get infected as opposed to getting your vaccine, because waiting to get infected makes you vulnerable to disease, the impacts of the disease. We have said over and over again that the vaccine has a remarkable safety profile. Very, like, one in millions of people have adverse events like sore arms and fevers and stuff. So I want you, well, more serious than this. Sore arms are common. But I want you to understand that by getting a natural infection, you are running the risk of long COVID, okay, which is estimated to be occurring in anywhere from 20 to 80% of the people, including children who get COVID. So even if you recover from COVID, you can have months and months of prolonged symptoms. We are seeing serious infections in children. We are seeing deaths in children, although not nearly as great as in the rest of the population. And don't forget the impact that it has of just being sick. People not being able to go to work, kids having to stay home, parents having to miss work because they're staying home with sick children. So there's just a lot of impact of disease as opposed to a vaccine. So I wouldn't risk getting a disease if there is a effective and safe vaccine out there, which there is.
Okay, the next question, and Doc, it's 4 o'clock, just so you're aware. We have several questions to go. Heidi Marie, Dr. Annette, I was wondering if you get the monoclonal antibodies when you have COVID and then you recover. Let's say you get COVID again a few months later. Will you be able to get the monoclonal antibodies again? I've heard
Yeah.
people
Hi,
say they
Heidi.
caught it more than once.
So I am not aware of any contraindication of reusing a therapeutic, whether it be the monoclonal, and now we have the antivirals. In fact, you can use one and then you can use the other one, even with the same illness. There are restrictions after monoclonal of getting vaccinated. Okay, so you would have to delay your if you had not already been fully vaccinated, you would have to delay your vaccination status after a monoclonal. Um, and yes, there are people getting reinfected, but again, the most common people who are getting reinfected are people who have not been vaccinated. They're the people who were infected last year and now are getting infected again with Omicron. So, yes, you can catch COVID more than once, but we've had so many variants happen that I think more likely what happens is every time a new variant comes in, that you're going to be susceptible to the new variant. In other words, I don't think you get Omicron today, recover, and then get Omicron again in a month. Don't think that happens. I think a natural infection protects you for several months. It looks like at least 90 days, and we're talking 6 months as well. And then beyond that, by then the virus has mutated, and then you're a little bit more susceptible again.
All right, the next question is from Jonathan. He says, ask, what is the survival rate with Omicron?
I think it's a little too early to tell. I think what is appearing in the literature is very clear that it is less severe than the Delta variant and the previous variants, which had that I think 1% mortality rate. Of course, that varies a lot depending on what population you look at, right? Um, and I think we're going to find that the Omicron is less severe. The problem with Omicron is it's so much more contagious. We just have the sheer number of people who are sicker, who are, excuse me, who are getting sick at the same time, and that sheer number, even with a less severe, can still cause a lot of havoc and problems in a society and a community. So I don't have the exact numbers for you yet, but I'm sure we'll see those pretty soon.
Okay, Nikki asks again, with Omicron, how many days before you're past the worst of the symptoms?
It varies so much, Nikki, from person to person. Again, I'm hearing 30 to 40% of Omicron infections are asymptomatic completely. No symptoms or such mild symptoms you wouldn't even know you're sick, which is another good reason to test, okay? That doesn't mean that your infection, which is causing you absolutely no problems, could be passed on to somebody who can be sick for weeks and weeks. And we know of a lot of people who have, as we call this, long COVID symptom, where they feel sick for months. Typically, the virus peaks and comes down in that first week, which is why the CDC is saying 5 days. The vast majority of people, they have this huge viral replication. And when viruses are replicating in our body, we feel like hell, right? So we feel achy and feverish and all the things that our body is trying to suppress that viral replication. And then beyond that, there's kind of a post-viral inflammatory process that occurs with COVID. And some people get hit with that very hard, and some people hardly experience any of it. And honestly, I think that's another thing we're just going to have to learn is like, why are some people sick for so much longer than others? I don't have that answer for you for sure. And again, it's hard to say, is it just because of underlying health conditions? No, we have some really healthy people who get sick for a very long time and vice versa. So it's a little hard to answer.
All right, I'm going to skip down, Elise, just so you're aware, to Kathy's question. She said, is there a way to know where the most COVID spread is in the county?
No, it's everywhere though, I can tell you that. This goes back to counting cases when we had case counts. People always wanted to say how many cases in my community. It's widespread. 35% positivity rate, it's widespread. And there are certain parts of the community that don't test very much. They get sick, they stay home, hopefully. I would assume that the less populated areas you are in, the better off you are. Okay. In general, urban areas tend to transmit virus a lot quicker because everybody's kind of closer together. Um, and more rural areas tend not to have the same rapid spread because people live further apart. But that doesn't mean that you're not susceptible if you go into a public space where there's a lot of people. In fact, if you look at the state map, there isn't a county in Michigan right now that isn't at very, very high transmission rates.
Okay, we've got a lot of chatter going on, so I'm scrolling down to find the appropriate questions. A lot of people are saying thank you, Doc.
A lot of people are not saying thank you, Doc.
A lot of people are not. They're
Right.
arguing amongst each other, so we are just going to skip down.
Which is another reason, by the way, people, I know that there was some concern about that we only open our comments section when we do this Facebook Live, but we found that it
Right,
was providing a forum for people to um, pass back and forth misinformation and untrue information. We can't stop people from doing that, but we certainly don't want them to do that on our site, right? We consider
right,
ourselves a source of the best information available, the most factual. So when people get started like that, it doesn't serve our mission and our purpose. So
right. So I'm scrolling down to way down to Jason's question. He asked, why are masks mandated for school hours but not for after school activities like basketball games and
mhm.
sports practices?
You pick your battles. You pick your battles and you win the war. And we were trying to keep the schools open and try and reduce that initial surge as we were talking about going from going from a relatively modest transmission. Delta was coming down, if you remember. We were starting to see a reduction to anticipating a very large surge, and our focus was trying to keep kids in the classroom. You notice we also didn't issue a mandate for businesses or any other areas. And again, it's not because we were targeting children, it's because we were prioritizing children to try that school age group to try and keep the schools open and keep them in person learning, which we know is so, so important for kids.
Dion asked, why should I get vaccinated if I can still get and spread COVID, even if you already had COVID and had little to no symptoms?
Because if you're vaccinated, you're much more likely to have a mild symptoms, not be hospitalized, and not to die. And I think those are pretty good reasons. Secondary reasons: if you get vaccinated, you're much less likely to spread. So if you're waiting for a guarantee of getting a vaccine that will guarantee you not to get sick at all, not to spread it, you're living on the wrong planet. We don't have treatments like that in any area of medicine, but it does a pretty darn good job of reducing that risk for not just yourself, but for everyone else. And when you look at population level, the value of immunizations at a population level, not on your individual well-being, but on a population level, when you have a population that's immune, then the virus doesn't have a place to land. And you'll start seeing a reduction or sometimes even an elimination of that virus from the whole community. And then everyone benefits from that because then the virus is rare or is not detected any longer. It doesn't have anywhere to circulate. So lots of good reasons to get vaccinated.
All right, Joe and Pam both kind of ask, how many children have passed away in St. Clair County with COVID or due to
I
COVID?
think we're aware of one. A one. We're Yeah, nationally we know of 800. Michigan wise, I know that there was just a couple more in Kent County. I saw that. So it's rare, but it's not unheard of. And not only that, but you can't underestimate the impact of sick children. Who wants to see a sick child? Sick households. And don't forget about the complications of COVID, not just long COVID, but the multi-inflammatory syndrome complex of children, which is hospitalizing children to a greater and greater extent. The hospitalizations for all age groups is increasing, but the hospitalizations for children is increasing more than the other age groups, which is alarming, and probably because kids aren't vaccinated as effectively as our older population. Not because the virus is worse in kids. I don't want you guys to think that, but because I think our children are more vulnerable. Hey, they go to school. They're always in this congregate setting. So again, they're worth prioritizing in our minds.
Doc, I don't know if you answered this or not, but Kathy wondered if you answered about where in the county we have the most spread.
Yeah, I did answer that question, and the
Okay.
answer is who knows? It's everywhere. Do you have an answer for that, Mr. Data Man? Every zip code in our county has high levels of transmission at this time.
Okay. This is from Julie. She asked, if someone had Delta, does that infection provide protection from Omicron? Thank you for all you do.
Probably some, but it's clear that a previous infection with any of the previous variants is not providing the same level of protection as it did from the previous variants, right? So there's something unique, and that's what we were talking about. There's some unique attributes. There's unique things about Omicron that have made it particularly uh, harder to deal with and control. It's infecting. There's more breakthrough infection, particularly amongst people who are previously infected with Omicron.
Penny asked, why is my daughter not able to get the monoclonal as she is on Humira and has been fully vaccinated and boosted? She has some sinus symptoms.
Yeah, there's aged. I don't know how old your daughter is. Let's see. Any age with moderate severe immunocompromise. I do believe our current protocols, I think, are 12 and older, but I might be wrong. I'll have to check on that. Could you Penny, could you send your information in through the COVID-19 and let me double check that, and I can reevaluate. Now, here's a new problem, everybody. We don't have enough monoclonals. Omicron does not respond to two of the three monoclonals we have, and the one that still works against Omicron is in very short supply. So going back, Penny, unfortunately, I don't know what time frame you're talking about, but right now, the criteria for using the monoclonal that still works, which is you have to basically be um, over 75 and not fully vaccinated, over 65 and not fully vaccinated with risk factors, or you have to be, it says any age per applicable EUA, and I think there is an age limit as well with sotrovimab, and I don't know whether it's 12 or 16. I'll have to look. But those people have to be moderate or severe immunocompromised. So your daughter may qualify, and if you could send me that information, I'll double check that age limit, and we can talk to the infusion locations and see if we can hook her in.
All right. Christy asked, what is the number of children seeking care for an adverse reaction after receiving a COVID vaccine?
Um, so so adverse reactions for COVID vaccine, the most common are sore arm, some body aches. I believe the last time I saw that was upwards of 50-60% of people who that get those are very common. Adverse events that require hospital or medical care, those are considered serious adverse reactions, and they're rare. Well, I've heard of a couple, yeah, but they're rare. And they follow those through the surveillance systems we have nationally, and they remain at a very low rate, a couple per million for the more common ones, like the myocarditis for the kids. Um, not, I think myocarditis for the kids is probably the biggest one, and that's a couple cases per million. And if you get COVID, it's a few cases per 10,000. So your risk of getting these side effects that require medical care are still disproportionately higher with the infection than with the vaccine. But you can check all that on our website. I think we have a link to the vaccine adverse events as well as the national sites, the CDC and the state has good links to that as well. But they're not common; they're rare.
All right, and the looks like the last question, it's for 14, is from Jessica, and she asked, "Why is my kid getting exposed more at school with masks than without?"
Why is your kid getting exposed more with masks? I don't understand that question. I guess the answer is yeah, when COVID is widespread in a community, your kid is going to get exposed at school as well as everywhere else he goes or he or she goes. If they're wearing masks, they're less likely to get infected or sick. So that's the risk benefit ratio. The bad and worst scenarios we have to ask if you don't want to get your kid exposed, he can't go anywhere and you can't go anywhere. And that's the problem is that we really can't do that in a society where this pandemic is going on and on and on. Remember, we tried that at the beginning of 2020, and it was kind of a disaster. And let's face it, it didn't even work. We still had transmission of the virus, and it still came back. So exposure is inevitable. Infection, not so much. And everybody should be doing all the things they can to reduce that risk of transmission of the virus, which is masks, which is hand washing, which is distancing beyond 6 feet, um, and more, even importantly, vaccine, and trying to make sure that if you're sick or exposed, that you follow our isolation and quarantine guidelines, because that also reduces how much exposure you're giving to other people.
Um, Penny followed up with you, Doc, when you asked how old her daughter was. She said, "My daughter is 48, lives in Hawaii, and she's been
Oh,
diagnosed with COVID. They told
oh,
her she
okay.
doesn't qualify for monoclonal even on Humira."
I think she would. I think she would actually. I think Humira would be considered an immune suppressing drug, but they may be prioritizing this, as many of us are, based on the supply of medications they have. So they may have more severe immune suppressant criteria than that. And I can't speak for the healthcare providers there, but I can tell you everyone needs to be prepared with the shortage of resources that we have in the near future. I do think we're going to get through this, but in the near future, there is not going to be enough treatment for everybody who needs it or wants it or would benefit from it. And that is just the unfortunate truth.
All right, Doc, that's it for today. Any closing comments before we say goodbye?
I just appreciate everyone's patience as we waddle through this. We will be looking at all the information carefully and providing the community an update probably no later than Tuesday of next week. I think everyone wants to know when. So that was some of our internal. We have a lot of discussion to make with community leaders and each other with our data. So stay tuned.